Hi everyone, my name's Lucia. I am on my neuroradiology rotation, so I thought I'd just make a PowerPoint of just some basic concepts. So first imaging modality that we're going to talk about is the CT head. CT head is most commonly, when someone comes in, maybe they have a trauma or something, that's kind of the first line imaging that you're going to get. Most of the times you're going to get it without contrast. It's a really quick screening exam looking for potential stroke, hemorrhage, fracture, edema, hydrocephalus. It's also a follow-up exam. If you get a CT head with contrast, you might as well just get an MRI. It's most useful for looking at infections, tumors, but sometimes it's just better to go for straight with an MRI rather than a CT head with contrast. There's no real practical use of a CT head with contrast in the common era. Next, we're going to talk about a CT angiogram. This is usually gotten with contrast. It's an arterial type exam to evaluate the arteries of the neck and the brain. Again, this is commonly used for stroke, intracranial hemorrhage, trauma, aneurysms, and vascular malformations. You can also get a CT venogram. The timing of the actual contrast is later. This can be used for venous thrombosis and venous trauma to evaluate for these. In terms of x-rays, they really are not useful in brain imaging. It's very limited use, but two things are stent evaluations and positioning, as well as hardware positioning. But other than that, not really used in brain. Of course, then we have the MRI brain with and without contrast. This is like the biggest staple in neuro radiology. Limitations would be patients with metallic foreign bodies, incompatible implants. Also, a lot of people know that if you've ever had a brain MRI, they can be pretty claustrophobic. The actual imaging modality takes longer and it's more expensive. There's a lot of different MRI sequences. For example, T1 weighted imaging, T2 weighted imaging, FLAIR, that we'll talk about a little more, but that's kind of like when water is suppressed. And then diffuse imaging. Diffusion imaging talks about how well water moves. And then you have blood sensitive imaging and calcium sensitive imaging, and that's your GRE and SWI. And then you have your T1 post contrast, and I'll show examples of all of those. So this is T1 pre-contrast, and again, we'll talk about post contrast in a second. Really, the biggest thing for this is if you want to look at anatomy, this is the best kind of image that you would get. It's good for overall evaluation of brain structure, alignment, positioning. But yeah, overall, you're looking at anatomy. T2 weighted imaging is another type of MRI that you can get. So I think of T2O2, so water is brighter. This is really good for evaluation of brain edema, swelling, soft tissues, and fluid structures. And again, any abnormality is going to be bright on T2. Yeah. This is a really popular imaging modality. It's called a FLAIR, MRI FLAIR. FLAIR stands for fluid attenuation inversion recovery. Basically, it's a T2 image with the CSF suppressed. So again, could be very useful for brain edema, swelling, soft tissue structures, and fluid structures. Again, abnormalities will be bright. It's one of the best sequences to look at abnormalities, and it's best sequence to compare to CT as well. Whatever is dark on CT will be bright on FLAIR. Okay, so this is looking at T2 versus This is looking at T1 again, which is for looking at anatomy mostly, and then FLAIR T1, you're going to have the white matter is going to be bright, as you can see here, and the gray matter is going to be dark. On a flare, it's going to be the opposite. So white matter is going to be dark, and gray matter is going to be bright. So again, here white matter is bright, gray matter is dark. Here, gray matter is bright, and white matter is dark. A way to remember this is white fades, gray grows on flare. So white fades, white matter is dark, and then gray grows, gray matter is bright. DWI stands for diffusion weighted imaging. It demonstrates how well water moves within tissue. Most of the time this is used for evaluation of stroke. Water is restricted in stroke because of the sodium potassium channels fail, so edema pours into the cells, so you'll see water is bright on DWI. These scans I'm not going to talk a lot about just because I don't know much about them, but GRE SWI, so these are looking at calcium and blood products. Usually they would be dark. GRE is gradient echo, SWI is susceptibility weighted imaging. Last but not least, we have the T1 post-contrast. This is T1 after contrast imaging. It's looking at areas of blood-brain barrier breakdown. So again, really good at looking for tumors, metastasis, infection, stroke, and more. Just noting that a good way to tell that this is a T1 post-contrast is normal structures will enhance, such as the vessels, sinuses, choroid plexus, and the dura. This is an MRA head, usually without contrast. It is really good at evaluating vessels of the brain and the circle of Willis, which is shown here. Common uses would be non-emergent evaluation of stroke, aneurysms, and vascular malformations. Then we have MRA neck, which is evaluating the vessels of the neck, as well as the arch to the circle of Willis. And contrast is definitely a better option for these to see the great vessels. Again, common uses would be non-emergent evaluation of stroke and carotid stenosis as well. Lastly, we'll talk about MR venogram. So this can be used with or without contrast. However, with is usually better because it avoids having artifacts. So with allows for fewer artifacts. This is venous timed to evaluate the arteries of the brain, and this is really good for evaluation of venous infarcts and venous thrombosis. All of these slides, concept, and everything were from learnneuoradiology.com, as well as the YouTube video. I just made this video because it's easier for me to try to learn it myself by speaking myself, but yeah, definitely check them out. They have really good videos, resources, and all of it's free. So